Hi guys, this is EricCressey. I want to take you through 3 warm-up drills that I actually really disagree with that I see from a lot of our young pitchers today. And I think the problem with that is they think in terms of gross movements too much and they don't really think about how the joint works. So the 3 that we're going to talk about today really are with respect to the shoulder. One of the things I get asked all the time is, what do you think of J-bands? What do you think of crossover symmetry? And, I kind of respond in the sense that, what do you think of yoga? What do you think of weight training? These are, broad disciplines, and there's a lot of different things you can do underneath those disciplines. It comes down to who are we doing them with and what kind of technique are we using while we do them. So we're going to demonstrate some stuff with the J-band today because I think it's a good example. And Alan Jager's a great friend of mine, and I really believe in the product. It's just a matter of doing the exercises correctly. So one of the things that we see in our throwers is they tend to get very loose in the front. Okay, so what happens over the course of time as you lay your arm back over and over again to throw, as you develop more and more external rotation, the ball wants to ride forward in the socket. Okay, so what happens is you acquire this anterior laxity, so the ligaments in the front of your shoulder have a little bit more give to them as you keep throwing and throwing and throwing. And it's one reason why throwers need to take some time off throughout the year to regain some of that anterior stability. And what we're seeing more and more nowadays are surgeries called anterior capsule plication. Basically what that means is throwers get too loose in the front and they need to go in surgically and tighten it up. One of the problems though is, in addition to throwing, stretching somebody into external rotation or into extension can create more glide forward of the ball in the socket. So beyond just what we acquire from throwing, we can create more from our training. So we need to be really cautious about whether we stretch the shoulder at all, and if we do, how we actually do it. So I think you should never stretch a shoulder into external rotation. I think you should never stretch a shoulder into humeral extension. Okay? So at the end of the day, keeping a shoulder healthy is all about maintaining the ball and its congruency with the socket. So some of the stuff that I see when we walk out to the fields is, we'll see guys that'll grab their bands and then they'll just pull back into extension, right? So as I take my arms back behind my body, the ball rides forward in the socket and I create some laxity in the front. So stay away from anything behind your body when you're stretching. Likewise, coming up and doing a lot of stuff here is not going to be good for you. Why? First off, it's going to crank on that shoulder into external rotation and create more of that anterior instability if you're not really careful on how you position. But second, we're actually creating a lot more medial elbow stress. So we're creating what's called valgus stress. And what you'll see with a lot of throwers is they may have more of what we call a valgus carrying angle on their throwing side, meaning that elbow will kind of shape more of a triangle when it comes in. And that can be a risk factor for UCL injuries and other medial elbow pain. So we don't want to do anything that's going to exacerbate that, right? We get enough of that from throwing. So we want to make sure that our pre-throwing stuff is really tailored to our needs, right? So if we're really, really loose, we need to focus on getting more stable. If we're really tight, we need to use mobility exercises, but we need to do them correctly. Now going back to that external rotation variation, if we're talking about creating that position anyway, think about what happens if I get out here and I'm not aware of my core posture, right? If I slip up to extension there, think about what happens to my shoulder blades, right? So I may glide down with my shoulder blades. We've already talked about how the external rotation component may change where the ball sits in the socket. Here I've taken the socket and I've probably cranked it down into some depression, so I can't upwardly rotate to that good arm slot. So being aware of your core positioning while you do all your rotator cuff stuff is very, very important. So obviously stretching in this position is bad, but if you insist that you have to do it, you might as well maintain that core posture. So spinning it around, what are some things that you can do instead? Basic rotator cuff stuff, where you might be in a split stance, and all you're going to do is you're going to work on maintaining that congruency of the ball and socket. What you'll notice as I go through this, there's no forward head posture. There's no big arch, right? It's just the ball moving on the socket instead of me cranking into lumbar extension. So what we see from a lot of the guys nowadays are things like this. Okay? That's not doing anything for you. Focus on moving correctly through your core first, because it's going to put you in a position to put your shoulder blade on the right spot in your rib cage, and in turn that ball and socket congruency is going to be much better off. But recap, don't stretch that shoulder in the front by going into external rotation or extension with your band work, and also make sure that as you're doing your rotator cuff stuff, don't slip into extension at your low back. Keep a neutral spine and work ball on socket rotation, and you'll find that you don't actually have as much external rotation as you really think.